Welcome everyone for a quick revision in 30 minutes. Subject Psychiatric Nursing. Stay tuned for the upcoming 30 minutes for a grand success. In this video, we are discussing the most important topics and the answer keys. Number one question is related to the classification of mental illness. It is based on ICD-10 and DSM-5 classification. ICD-10 classification F0 to F09 talking about organic mental disorders, example delirium and dementia. F10, F19 talking about alcohol, opiate, tobacco and other substance induced disorders. F20, F19 talking about schizophrenia and schizotypal and delusional disorders. Most important topic is schizophrenia F20. Now F31 to F39 talking about mood disorders, example manic episode, depressive episode and BPAD, bipolar affective disorder. F40 to 48 talking about neurotic disorders, examples anxiety disorders, obsessive compulsive disorders, dissociative disorders, etc. F50 to 59 talking about non-organic eating and sleeping disorders along with the sexual dysfunctions. Remember, most important F40 and 30 category. F60 talking about personality disorders along with sexual preference, paraphilias. F70 talking about mental retardation. F80 talking about some of the pervasive developmental disorders, especially the autism. F90 talking about hyperkinetic disorders or the attention deficit hyperactivity disorders and the conduct disorders. So in summary, F0 to F99 10 blocks. Now DSM-4, I am not discussing DSM-5 classification. DSM-4 is based on 5 axes. Axis 1, all the major psychiatric disorders. Axis 2, mental retardation and the personality disorders. Axis 3, current medical conditions. Axis 4, psychosocial and environmental problems. Axis 5, global assessment functioning of score. Simply we can say GAF score. However, in DSM-5, axis 1, 2, 3 are eliminated. It is clubbed together as per the other disorders, and axis 4 and 5 are discussed. Dementia and the delirium. Dementia is a chronic organic brain syndrome characterized by impairment in the memory, intellect and the personality without impairment in the consciousness. Delirium is an acute organic brain syndrome in which there is disturbance of the consciousness and the cognition. Let us have a quick summary of difference between delirium and dementia. Onset in delirium, acute; dementia, insidious or the chronic in nature. And consciousness is clouded in delirium, however it is normal in dementia. Orientation disturbed in delirium, however it is disturbed only in the late stage. Memory disturbance significant in the dementia, especially recent and the immediate memory. Now diurnal variation such as sundowning is significant in dementia, especially the Alzheimer's type. However, it can be present in delirium. Now perceptual disturbances are more common in delirium, and other features such as catastrophic reaction is more common in dementia as compared to delirium. Now the schizophrenia, it is characterized by 5 symptoms: delusion, hallucination, disorganized speech, disorganized behavior and the negative symptoms which include apathy, logia, asociality, anhedonia and the evolution. The first 4 symptoms are called as positive symptoms. Employers 4A, that is again a previous older sign and symptoms of schizophrenia given by Eugen Bloyer. It includes ambivalence, autistic thinking, affective incongruity, and associate looseness. The most common schizophrenia seen in clinical practice is paranoid schizophrenia. It has the following signs and symptoms: delusion of persecution, delusion of reference, delusion of jealousy, delusion of grandiosity, and auditory hallucination. Among these five, usually three should be present. Now, the catatonic schizophrenia, the sign and symptoms are mutism, rigidity, stupor, posturing, excitement, echolalia or echopraxia, negativism, and waxy flexibility. Triad symptoms of depression are depressive episodes, depressed mood, depressed cognitions, decreased psychomotor activity. However, in manic episode, elevated mood, increased pressure of speech and thought, and increased psychomotor activity are the triad symptoms. Classification of anxiety disorders. Phobic anxiety disorders is of three types: agoraphobia, social phobia, specific phobia. Agoraphobia, fear in which easy escape is not possible. Social phobia, speaking or talking or watching in social situations. Specific phobia, related to specific. Now, F41 other anxiety disorders such as panic and generalized anxiety disorders. Obsessive compulsive disorder. Obsession is persistent, intrusive, and unwanted thoughts. Compulsion is stereotyped or repeated or ritualistic behaviors to reduce the distress and anxiety associated with the obsession. Most common obsessional themes are contamination fears, pathological doubt, need for symmetry or order, sexual or aggressive obsession. Common compulsive behaviors are repeated checking, washing, and counting. Mental retardation or intellectual disability is equal to reduced level of intellectual functioning plus impairment of adaptive skills. Two things: reduced IQ plus impairment of adaptive skills. Causes of mental retardation, especially genetic causes like chromosomal disorders, congenital metabolic disorders. Prenatal causes includes infections such as rubella, toxins such as alcohol, nutritional deficiencies, and the maternal factors such as placental insufficiency or the preeclampsia. Now, the perinatal and the postnatal causes includes perinatal complications such as brain injury or cerebral palsy, now followed by malnutrition. This may have the risk factors towards mental retardation. IQ range of mental retardation: mild 50 to 69, which is considered as educable; 35 to 49 is considered as moderate; 20 to 34 is considered as severe, called as dependent; below 20 it is called as profound or the life support. Now we are entering towards one of the most important questions: therapeutic nurse patient relationship. Number one, the definition: 3 points should be needed. It's an interpersonal interaction between the nurse and the client, focusing on client's specific needs. Components of therapeutic nurse patient relationship: it include genuineness, confidentiality, respect, empathy, self awareness, and trust. Remember the code: genuine and confidential rest. Rest stands for R for respect, E for empathy, S for self awareness, T for trust. Phases: it includes pre-interaction, introductory or orientation, working, and the termination phase. Major goals in pre-interaction is self-exploration with the aid of Johari window and plan for the first meeting. Introductory or the orientation phase includes acceptance, open communication, and formulation of a contract. Working phase includes three steps. Number one, exploration of the problems and the alternatives, exploration of the coping mechanisms. Number two, focusing on behavioral change. Number three, overcoming or dealing with resistance, transference, and countertransference, and the boundary violation. These are therapeutic impasses. At last phase, termination phase, it is discussed in the initial stage of interaction, in which review of the progress and goals and formulating a plan of action are the major area of concern by the nurse. Therapeutic communication techniques. Let us remember this by the acronym LISTEN to RCH and OBG FEST. Listen means listening, one of the most important therapeutic communication technique. Out of the 12, most important is listening, followed by RCH. RCH are for restating and reflection, C for clarification, H for humor. Next is OBG. O stands for offering self, B for broad opening, G for giving recognition. At last, FEST. F for focusing, E for exploring, S for silence, T for theme identification. Now, non-therapeutic communication technique. Any of these six are there in the option. We need to eliminate this as a non-therapeutic communication technique, especially giving advice, giving reassurance, defending, probing, belittling, and blaming. Moving towards the therapeutic aspect of psychiatry, the most important physical therapy is electroconvulsive therapy. Definition, major points. It is a brain stimulation modality in which electric current is passed via electrodes placed against the head to produce a seizure. Please remember these 5 points in the definition of ECT. Modern ECT is performed under 4 things. Number 1, anesthesia. Number 2, muscle relaxant. Number 3, oxygenation. Number 4, anticholinergic agent. Indication, severe depression with suicidal risk and BPAD, especially the manic type, and all the other treatment resistant cases. Contraindication, absolutely contraindicated in conditions with increased intracranial pressure such as aneurysm, brain tumors, cerebrovascular diseases, etc. General side effects are headache, muscle weakness, drowsiness. Cognitive side effects are amnesia, especially anterograde amnesia. Fracture is a very rare side effect. Electric current is 70 to 110 volt or 500 to 1000 milliampere. Duration is 0.7 to 1.5 seconds. Electrodes are placed bilaterally usually. Frequency 3 times in a week. Course is 6 to 12 sessions in a cycle. Atropine is given as an anticholinergic agent. Thiopentone sodium is given as an anesthetic agent. Succinylcholine is given as a muscle relaxant. Role of nurse before ECT, most important thing, it is written informed consent and nil per oral for at least 8 hours. Others are withholding certain medications such as anticonvulsants and removal of metallic articles or artificial dentures. During ECT, position is supine position. Medications as per the order: mouth gag, oxygenation, observation of the vital signs, and seizure duration. Usually minimum at least 25 seconds should be needed. After ECT, side lying position, lateral position, then observation of the vital signs and restriction of the oral intake till the return of the gag reflex. 3 points, 3 plus 3 plus 3. Now, psychopharmacology. In that, antipsychotic drugs, Most important classification: typical, atypical. Typical is also called as neuroleptics or dopamine antagonist. Atypical also called as serotonin dopamine antagonist. Examples: typical chlorpromazine, flufenazine, decanoate, and haloperidol. Atypical risperidone, olanzapine, clozapine, amisulpride, quetiapine, aripiprazole, and ziprasidone. Most important is chlorpromazine and haloperidol from the typical, risperidone and olanzapine from the atypical. Now, extrapyramidal symptoms as a side effect of antipsychotic drugs includes acute dystonia, pseudo-Parkinsonism, akathisia, tardive dyskinesia as a late reaction, then neuroleptic malignant syndrome. Other side effects include anticholinergic side effects, sedation, weight gain, seizure, granulocytosis, orthostatic hypotension, and photosensitivity. Classification of antidepressants includes tricyclic antidepressants. Example: imipramine. Number 2, monoamine oxidase inhibitors. Example: selaglyn, phenelcyne. Number 3, selective serotonin reuptake inhibitors. Example: fluoxetine, paroxetine, and sertraline. Number 4, selective norepinephrine reuptake inhibitors. Example: venlafaxine. Number 5, others or the atypicals such as bupropion, mirtazapine, trazodone, etc. Major side effects: TCA, anticholinergic effect, endocrine and sexual side effects, and the cardiovascular side effects. However, with SSRI, gastrointestinal side effects such as nausea, diarrhea, and anorexia, insomnia, headache, anxiety, tremor, and delayed orgasm. Anti-anxiety major classifications are benzodiazepines, barbiturates, non-benzodiazepines, and antidepressants. In the benzodiazepine, short acting is Alprax, alprazolam. Medium acting is lorazepam. Long acting is clonazepam or diazepam. Non-benzodiazepine, example buspirone and solpidem. Antidepressants, example fluoxetine or paroxetine, used for anti-anxiety purpose. Benzodiazepine major side effects are drowsiness, confusion, and lethargy. Toxicity includes excessive sedation, respiratory depression, and coma. Antidote is romacicone or flumazenil. Withdrawal symptoms includes anxiety, insomnia, tremor, palpitations, and seizure, the most important. Moving towards mood stabilizing agents. Most important is lithium carbonate. Now other anticonvulsants such as valproic acid, carbamazepine, lamotrigine, certain antipsychotics such as aripiprazole, olanzapine, quetiapine, and risperidone. Rarely calcium channel blocker also used. Lithium, the most important question. In acute mania, it is needed in a dose of 900 to 1200 milligram per day. Routine investigations are needed. Complete hemogram, thyroid function test, and renal function test are mandatory. Repeated estimation is needed as a maintenance dose or range include 0.6 to 1.2 milliequivalents per liter. If it is more than 2 milliequivalents per liter, it is considered as toxic. Sample estimation should be done 12 to 24 hours of the last dose. In case of toxicity, gradually taper off lithium. While taking lithium, consume a diet adequate in sodium as well as adequate in water. Monitor for weight gain. What are the toxicity? Lithium severe toxicity signs and symptoms include persistent nausea and vomiting, severe diarrhea, excessive dilute urine, blurred vision, tinnitus, tremors, and seizures. I hope this quick revision segment will rebuild the pathways of your success. All the best. Thank you.